in collaboration with the Cyprus Mail. This is the Cyprus News Digest with Rosie Charalambous.
Coming up on the programme today, the EU Commissioner for the Environment was in Cyprus this week.
There are solutions today where we are talking about a win-win for the environment and for the economy as well.
The Minister of Education opened the London Science Museum's exhibition entitled Your Planet Needs You, which will run in Nicosia until April.
It is very useful to utilize modern technology to which students are more familiarized.
We'll take a look at health issues following my visit to the Week of Health and Innovation in Denmark. Among the topics, antimicrobial resistance.
Enormous amounts of antibiotics are being used, some as growth promoters in agriculture, others rather indiscriminately by the medical profession.
And childhood obesity.
In disadvantaged groups now we are facing with the so-called double burden, so some of them are underweight, but obesity is also growing within this group.
And we'll finish on a lighter note. The Georgian ambassador to Cyprus is supporting rugby on the island.
I see all the values and principles what I want to teach my children and my son.
The EU Commissioner for the Environment, Maritime Affairs and Fisheries, Karmenou Vella, was in Cyprus earlier this week, and as well as his official contacts, he attended a roundtable discussion with stakeholders on engaging nature, people and the economy.
First of all, the intention of coming to Cyprus is to strengthen the already existing strong cooperation, not just between the European Union and Cyprus, but also between my commission work and the ministry here. Basically, with regards to the program, we started off by meeting the President of the Republic of Cyprus. We had a meeting with the minister responsible for the environment and the agriculture and fisheries. Then we had a meeting with the three standing committees in Parliament. The three committees were the External Affairs, Agriculture, Fisheries and the Environment. Then we had a visit to one of the important Natura 2000 sites of Oroclini, and I think that could be a very good model to showcase where if managed, Natura 2000 sites can give the results that we expect. Then I had the meeting with a number of stakeholders and NGOs, and I think we have a very positive and a constructive meeting where everyone was transparent in their comments and so on.
You seem to feel very strongly that it's time for all the different stakeholders to work together rather than against each other. What are the benefits?
Now more than ever, because if we work one against the other, the result is going to be chaos. We won't even move forward. The whole idea about the sustainable development goals is that everything we plan, everything, the way that we think, everything that we implement has got to be sustainable. Sustainable meaning that economic development projects have to take the environment into consideration. Environmental policies have to take economy into consideration. Because when these two merge and work together, then the third factor, which is society, will benefit. There are solutions today where we are talking about a win-win for the environment and for the economy as well. I spoke and I gave the example of the circular economy. That is one such solution which is addressing and benefiting both the environment as well as the economy.
The EU Commissioner for the Environment, Maritime Affairs and Fisheries, talking to me earlier this week in Nicosia.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
Education Minister Kostas Kallis inaugurated the Your Planet Needs You exhibition last week. Designed by the Science Museum in London, it's an interactive exhibition that will run until April at the State Fairgrounds in Makedonitissa, Nicosia. After he'd been round the exhibition, he told me what he thought.
It utilizes new technology in order to promote environmental awareness, which is, I think, is very close to what the students need right now. We feel that beyond the traditional techniques and methodology, it is very useful to utilize modern technology to which students are more familiarized.
And what about you? How did you do as you went round with your card? Did you design an environmentally friendly city?
Yes, actually, what I used to teach in the university, to teach to my students, I applied it during my round in the different stations.
And how do you think this sort of thing can be utilised in our schools? I mean, it's making it fun for the kids, isn't it? And isn't that important?
It shows us the way. I mean, we have to find ways in order to combine teaching environmental awareness with having fun. So there are similar programs in our schools, and we are trying to expand these programs. And I think that from this kind of exhibitions we can receive ideas how to do this.
And what about how many schools are going to visit this? I know that they've approached the Ministry of Education.
Yes.
Is every school in Cyprus going to have an ekthromi up here at some point before April?
I'm not sure if every school will come, but most of the schools, especially in Nicosia, they are encouraged to visit this exhibition.
Education Minister Kostas Kadis, after visiting the Your Planet Needs You exhibition at the State Fairgrounds in Nicosia.
Listen online to the Cyprus News Digest on YouTube or at cyprusmail.libsyn.com. The latest program is uploaded every Friday, and if you missed one, you can catch up there.
Last week I was in Odense in Denmark for a cluster meeting on non-communicable diseases. It was held as part of WHIN, which is the Week of Health and Innovation. And while I was there, I caught up with some of the keynote speakers. Dr. Charles Alessi is the Senior Advisor to Public Health England and Director of Antibiotic Prescribing for Public Health England, and that's all part of the Antimicrobial Resistance Initiative. If you're a regular listener, you'll know that we covered that a couple of years ago when I was in Brussels to talk exactly about that problem. Well, Charles joins us now. It's a global phenomenon, is I think what you were talking about today, and I presume that it's being tackled more successfully in some areas than others.
I think it's a global phenomenon, and it's going to take global action to deliver it. The use of antibiotics has proliferated to an incredible degree. I mean, if you our chief government medical officer has recently said if you go for a swim in the Ganges after the festival season, the level of antibiotic soup that you're swimming in is equivalent sometimes to the amount you find in people's blood vessels after treatment. Enormous amounts of antibiotics are being used, some as growth promoters in agriculture, others rather indiscriminately by the medical profession in general. And I
That's presumably the easiest one to tackle in the sense that you can access doctors directly, but very often in some countries around the world, people have sort of grown up with the idea that all they need is an antibiotic and they'll be fine, and the medical profession goes along with that.
Well, like with every problem, just accessing the doctors isn't, it's important, of course, but accessing the doctors and the people, for the people to understand that perhaps it's not in their best interest to have antibiotics when they don't need them. These drugs have side effects. They also, of course, potentially can cause problems, because in 20 years' time we're going to be worrying about people having treatments for cancer, for example, because if you're immunocompromised, perhaps there aren't the antibiotics to treat you if you get an infection.
How far is also the problem that for many years now I don't think there's been much research into finding new antibiotics that can deal with some of the resistant strains?
There has been a dearth of new antibiotics appearing, but I think there's a lot of emphasis now on everything from point-of-care testing, which is looking at ways in which we can identify people who may need antibiotics more than others. In other words, if we had a system which was simple enough to be used on a regular basis, then one can target the use of these antibiotics better. It's important not to blame anybody in this process. Doctors are put in a position where they have a sick child, for example. It is sometimes difficult to see what the difference between one condition and another is, whether it's viral and bacterial. I spent my life in general practice. I was in the same world. It is difficult. People's expectations are they want treatment. Of course they do. If you bring your child to see a physician, you want the child treated.
And you want it to get better within a day or two,
if
not
possible,
be told it might take a week.
Yes, if possible, you want it to get better yesterday. Yes. And of course then that leads to difficulties because with self-limiting illness, people are going to get better anyway, and they're going to get better if you give them an antibiotic or if you don't, and then it's difficult to tell whether it made a difference or not. And there's all this sort of stuff which one needs to manage. But in essence, I think the approach needs to be systematic. It needs to be underpinned by a system of transparency. I think that's really important. Us being open about the fact we have a problem. Hospitals publishing data in terms of their levels of resistance, people actually being informed, like through what you're doing, around the potential dangers of just using antibiotics because they're there. They have a use and they need to be used when they need to be used, not just because it sounds like a good idea. And I think if we take those approaches, I think we're going to be in a better place in the future.
It's down probably at the end to political will and government's understanding that long-term, if this issue is addressed, not only would it save them a great deal of money and resources in their medical systems, but it would make for a healthier population. How easy is it to get that message across to politicians?
Well, I think if the message is made cogently, politicians listen. If the message is taken and it becomes clear to a politician that, if they do nothing in 30 or 40 years' time, it's going to be difficult to perform a caesarean section because you don't know if you're going to have an antibiotic to treat it. It's going to be, if it's framed in that sort of way, then there is an element of urgency to get something done about this. And I think politicians will be interested. Of course they're interested. They're interested in the welfare of the population they represent. That's what they are. So I think the challenge is for us to actually make those stories mean more.
And in hospitals themselves, we've seen so many cases over recent years, and it seems they're on the increase, or they were until recently, about infections that lurk in hospitals. And let's just say at hygiene levels.
Well, cleaning of hospitals is actually quite a difficult process. It's not... of course, we have to have basic hygiene instituted in a system, absolutely. But it is also important to actually deep clean places occasionally, which is a far more systematic sort of root cleaning of a place, and that has to be done on occasions. And certainly where there is evidence of people who have resistance organisms, it's even more important to do it there.
It's done fairly well, I think, in the EU as a whole and certainly in Great Britain. But you've worked as well, as we said before, across the globe. You've visited many hospitals in third world countries. How well aware are they of really the very basic hygiene, which is the bottom rung of the ladder we've just been talking about?
I think clinical people all over the world are aware. Of course they're aware. Sometimes there isn't the political will in some jurisdictions to actually make those messages count. Some systems clearly are looking perhaps in not the most obvious place, super specialisation rather than basic care, but this is a journey. And I think we're all on the same journey. We just some of us happen to have started a little bit before others. That's the only difference.
And for Mr. Joe Public, who's the patient in the queue at the clinic, your advice to them?
Just be sure, you really need to get medical treatment when you seek medical treatment. We all have self-limiting infections like a cold. If you're in at risk group, get a flu jab. That's my message.
Dr. Charles Alessi, Senior Advisor to Public Health England. Obesity in Europe has never been higher, especially among children and adolescents. On average, quite shockingly, almost 1 in 3 children aged between 6 and 9 were overweight or obese in 2010. It's a condition often due to physical inactivity and a poor diet. And the Joint Action on Nutrition and Physical Activity, or JANPA, is a project that aims to address these issues. Dr. Victoria Kovac is the principal investigator for the World Health Organization Childhood Obesity Surveillance Initiative in Hungary, and I spoke to her recently about the project.
The mandate was given by the European Action Plan on Childhood Obesity in 2014, that there should be a formal mechanism for the member states where they can share their experience on the implementation and know-how on how to reach those goals which were set up by the action plan. And the joint action started in 2015, and now it's almost at the end. So in November we will have the final conference, and then it's closed.
It's quite shocking just how many people in the population qualify to be classed as childhood obese or certainly overweight. How did the plan come up with the priorities that should be the goals?
The priorities were set up by the high-level group on nutrition and physical activity, who are working on this since years. So it was elaborated by them. And of course all the member states put, or at least lobbied, for their own priority area, but at the end they came out with 8 areas, from breastfeeding to physical activity till the increasing research.
And of course nutrition, because I think you are a nutritionist. How far does that and the commercial problems we have with advertising targeting young people and children so that they pester their parents for the cereal that's full of sugar or the juices that aren't really juices at all? I mean, how far can you include those things? Because commercial lobbies are very powerful.
Yeah, that's true. And we just had a midterm evaluation for the action plan, and indeed what you are saying, that because restrict marketing to children was one of the action areas of the action plan, and we also tried to collect good practices on this sense. But I should tell you that we failed, because this is the area which are the much less targeted by the member states. We can conclude from other projects like the STEM mark that voluntary actions from the industry simply do not work. So we need legislation on this area, and the example for legislation is really a few. We have a legislation in Hungary, but the problem is the monitoring of actions. So even if there is a law in place, the implementation is not monitored, and there are no sanctions for not implementing it.
What about the role of the family and parents in all of this? Because really, ultimately, they are the ones who can influence their own children, because they know which buttons to push, if you like, to motivate their kids to lead a healthy lifestyle.
You are right. Parents are in the focus, even also in the joint action and also in the action plan. So empowering parents is one of the targets.
And how do you do that?
Knowing thing is one point. Implementing them and behaving like that is another. So there are periods which are better to intervene, where we are more successful, like when someone is pregnant. They are more ready to change. So that's a very good period for us to try to influence their lifestyle. But you are right, changing a kid's lifestyle or a family's lifestyle is really, really hard. So if you need numbers, it's like, I've just seen a very nice review about this, that from 1,000 family, you can be successful with 6.
That's really quite frightening, isn't it?
Yeah, it
so
is.
What needs to be done? I mean, now the projects are coming to an end, but presumably there'll be more projects because, as you say, some of them have not reached the targets. So the problem still exists, doesn't it?
Yeah, what is important, I guess, it's really to intervene as many levels and as many settings as possible in parallel. So we just illustrated that intervening only at family level or individual level it's not enough. If you do not have an enabling environment around you where the healthy choice is the easy choice, then you will fail most likely.
So the role of the schools then, I mean vegetable gardens in schools, nutrition lessons for even kindergarten children, how do you do it?
Yeah, you are listing exactly the recommendations of the action plan. So yes, I mean it's to create a healthy environment in schools. It has I would say 6 major elements. One is to create a physical activity promoting environment via active breaks, via introducing mandatory physical education in school, via training the physical education teachers to make the physical education more attractive for the kids. And then the school meals as it is, and the food environment like the vending machines and canteens should be as healthy as possible, preferably on a statutory way, because if you say that okay, these are the recommendations for school meals, there is no way out. And there is the restrict marketing. I mean, no sponsorship for school health, even by Coca-Cola, if I can say. So it's just like any kind of marketing should be restricted in the schools. It should be like a protected environment.
Are you confident that, since you know what needs to be done, that across the European bloc, for example, it can be done if everybody pulls together?
I mean, the context is and the culture is very country by country. So it's really important that you need to consider that, because what works in one country, it's not 100% sure that will work in another country.
We didn't mention poverty either, because there is a tendency, as far as I know, for people who are bordering on the poverty line or below it to have to make sometimes unhealthy choices because they simply can't afford to eat healthily.
Yes, in disadvantaged groups now we are facing with the so-called double burden. So some of them are underweight, but obesity is also growing within this group. What we can recommend for this is like incentives for them. So targeting these, I wouldn't say disadvantaged people, but disadvantaged area, because if you're targeting disadvantaged people, there is a high risk of bullying and stigmatization, which can be dangerous. So to avoid this, it's better to focus your resources and efforts on an area where you know it's the socioeconomic status is low in general, and then you put your money there.
All of this must be available online. People can easily access the information that they need to know, parents in particular. So what would be, in a nutshell, your advice to parents of children who perhaps are starting to show signs of being overweight or even obese?
What I would recommend on an individual level is to go for a step-by-step approach. So it's not like I'm eating and living an unhealthy way on Tuesday and then I will be completely healthy from Wednesday, because it will not be sustainable on a long term. So it's just like you should start to introduce small steps. You should look for steps which you can maintain on a long term. Like if you took a whole bar of chocolate yesterday, then now you decided, okay, from tomorrow I eat only the half.
Victoria Kovacs of the World Health Organization's Childhood Obesity Surveillance Initiative in Hungary, talking about the Joint Action on Nutrition and Physical Activity, a project that aims to reduce childhood obesity.
Get in touch with the Cyprus News Digest by emailing cyprusnewsdigest@gmail.com.
Revaz Lominadze is the Georgian ambassador to Nicosia, and I met him recently at a fundraiser for the Nicosia Barbarians Rugby Club. In fact, he wasn't just there supporting the event, he was sponsoring it with Georgian wines provided for the guests. I asked him what it was about rugby that made him such a fan.
Rugby is a lifestyle for me, and first of all, rugby is becoming very popular kind of sport in Georgia, but not because of this, because I love the soul of rugby. What means that I see the respect on the pitch when rugby players are doing their work. I see all the values and principles what I want to teach my children and my son, and that's why I'm supporting rugby everywhere. And of course now I'm in Cyprus, and this idea was very attractive for me, and that's why I'm trying to help the idea of development of rugby in Cyprus.
But of course Georgia is a champion team. I mean, you're pretty well at the top of Europe, aren't you?
Yes, we are in the top of European teams, and it happened in very short time period. This is amazing and diamond of this story. Because 10 years ago, I can tell you, it was nothing in Georgia, but now we are in the competition of the World Cup, and we are trying to be among the 6 nations, and etc., etc. And you cannot imagine how fast it's growing, how fast it's improving, and how popular it's becoming among the young generation of Georgia, because again, it's about the values, it's about striving for peace, and sometimes Georgia's geopolitical location of Georgia is not easy at all, and we have very rich and ancient history, and all our history was about fighting for the principles, and it's on the pitch now for Georgians, and that's why we're improving a lot in this.
How did Georgia get into the rugby idea in the first place? I mean, here in Cyprus we have a lot of expatriates who come from countries where rugby has for years, probably for over a century, been the sport. So we can understand them coming here and trying to start it up. But in Georgia, was it through expatriates or how?
Not historically. It came from the Black Sea and from the British people actually, because we had a good trade starting from medieval time with the entire world. And like football, we received football from the Black Sea, from the British guests, and then the people who knew this sport and who created this sport. And so it means that we were in the basement of this sport. That's why we were trying always to develop it, but we had some problems in the Soviet period, etc. But when we came out, now our goal, I mean the goal of Georgia, is to go back to the European family. And rugby is a part of this. It's not just about political achievement, it's not just about economical benefits or something like this. No, it's about our style of life, because European Union and Europe is a civilizational choice for Georgia, and rugby is there, so that's why it's very natural for us.
And I have to finally ask you, at the reception held as a fundraiser for the Nicosia Barbarians, the Georgian embassy sponsored the wine, and very nice wine it was too. So do tell us about the wine industry. Are you exporting this wine to Cyprus?
To Cyprus, not a lot, but we were on the way to do it. But actually, Georgian wine is very popular in the world. Why? Because of the story of the Georgian wine. Georgians are the first winemakers in Europe. And I'm not saying that because I'm ambassador of Georgia, and I have to say, no, it's recognized by the international experts and etc. And we have, until now, we have unique method of wine making in Georgia. It's amazing, it's interesting, and now world knows about this, and we're exporting a lot of wine to many countries in Europe, in post-Soviet space, and etc. And one of my goals is to bring it to Cyprus as well, and that's why. But first, I need the experts' idea about Georgian wine, like you, if you like it. It will be more attitude for me to go on with this idea to bring Georgian wine to Cyprus.
Well, I'm sure that's just one of the many things that the Georgian ambassador will be doing during his tenure here in Cyprus, because take my word for it, it's delicious. The Georgian ambassador to Nicosia, Revaz Lominadze, talking there about fundraising for the Nicosia Barbarians Rugby Club. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.